That's when that company says, well, so long, guys. This COVID testing kit we're going to make more money. We're going to sell off that part of the company. You guys could stick around. It's up to you. And it was just kind of sad. They just, I guess money talks,
Yeah.
right? Case management is very complicated. You get patients in, they're a train wreck. They have complicated issues. Where are they going to go from here? We could sew them together. We could patch them up. We could send them to OR and they can get surgery. But what happens after that? It's a life-changing event. So my contract is very high because I'm a manager. So that's like a year if I stay the whole year. The other jobs with the different tech companies, I may get a retainer of a month or it just depends. It's all over the place depending how big the project is.
What is up, guys? Jason here. Welcome back to the channel and our series Nurses to Riches, The Road to Fire. In this episode, we're going to hear from a longtime listener who started as a combat medic, went on to become a paramedic and an LVN, then enrolled himself in a bridge program to become an RN. He now works as an RN in more ways than you could count. One of those is as a nurse, helping to provide insight for the development of clinical programs that we use in our workplace. He also has an interesting story about how he landed a job with Kaiser Permanente. This episode is short because Doug had to call in during his lunch break, but if you're looking for unique nursing specialties to work in, you're going to want to listen to this episode. So, Doug, tell us a little bit about yourself and what it is that you currently do for a living.
Hi. Well, thanks for coming on with me. And I'm a registered nurse, Nurses to Riches, but I'm currently working as a manager building up a case management department in a pretty big hospital here in Los Angeles. And I've been doing consulting and independent work in this area for about 10 years. And I also have a business where I just got approved to do CEUs. So I'll be putting CEUs along with my education and training programs that I've already developed, but now I'm link CEUs with them. And I go to different seminars and we do presentations there with people that want to earn CEUs and listen to our presentations. And then on the bigger picture and kind of the long view stuff that I do is with technology. And technology companies have been reaching out to me for about 8 years now and wanting to develop clinical programs using remote monitoring devices and even using apps for remote monitoring and developing these programs to help manage ambulatory care. But we're also looking at transitional care for managing patients post-discharge.
Wow, that's a lot of stuff.
It's a lot of stuff. There's a lot of pants on the fire.
Okay, so let's go back. Where did you get your nursing degree?
I got my nursing degree right here in Southern California at a small little community college, Pasadena City College, but I'm very proud of that college. It was a very intensive program. I'm pretty old, as you guys could tell, but I went to the original LA County Medical Center and where all those movies were made and stuff like that. And that's where I saw the worst things and learned from some crazy stuff there. The reason I went there is because I was 6 years active duty in the United States Air Force and I was a medic. And then I became a combat medic while I was in the service. When I got out, I had already passed my paramedic license and LVN license, and I had those licenses when I got out, but I didn't have an RN license, which is really what you need for acute care as a civilian. And so, I could have worked in a nursing home or something like that, but that wasn't interesting to me. So I went to a bridge program and just did the least amount of education I could do to get into that program. And I got into the PCC program. It worked out because I had already bought a house in Pasadena. So it was literally walking distance from my house.
Awesome. So have you always lived in Pasadena or are you currently somewhere?
Yeah, I grew up here in St. Gabriel Valley, this whole area around here. I was lucky to be born into a pretty good family. And my grandfather was mayor of the city. And I learned about public health at a very young age because it's involved with politics. So I lived in this area. And then I knew that most of my family also served active duty. And so they said, Doug, we're not going to let you just stick around and go to college and whatever like that. Unless you're telling you got a full ride on college, you need to go in the service like the rest of us. And so that's what I did. I went into the service right after high school and knew that I was going to use that loan to buy a house as soon as possible. My initial goal when I graduated high school was to buy a house before I was 30, and I did that.
And did you buy your house in Pasadena?
Yes.
Amazing. So walk me through, after you got your nursing license, what did you do?
So after I got my nursing license, well, I already had my nursing license when I was out of the service. So I'd already started working jobs at Loma Linda University because I was at March Air Force Base, San Bernardino Community Hospital. I worked at some of those jobs. And then I realized that back then there wasn't a lot of male nurses. We were kind of rare back then. I would be the only male nurse in an acute care facility. And then there was a lot of job opportunities in skilled nursing facilities, but I wasn't really interested in that. I started working ambulatory care for an orthopedic group. And then when I learned that really there's not that many nurses at all in ambulatory care, it's usually nurses assistants or medical assistants. Then I got picked up by a health plan. Well, before I got picked up by a health plan, I got picked up by an IPA, which is the Independent Physician Association. Those were new in the nation. And they said, well, we're building a managed care organization. Would you like to join us? There was only 9 people in the company. And so I joined up with them. I learned about managed care at a very young age. I was like 26 years old and learned all the ins and outs in managed care. I got picked up by Molina Health Plan. They wanted somebody that knew about managed care, but they also wanted somebody that had a very strict kind of auditory type of background because they knew I was military. I guess they assumed that I was good at regulations and auditing things. And we got the contract for California to do Medicaid managed care. And so I went around and audited all the Molina clinics and all our contracted clinics to get us approved for the state and got Molina Health Plan started. So I was in Molina when they very first started a long time ago and when they went IPO. And that also helped out too, because I was there and I got the stocks in the company at that time too.
Okay. So there's a lot of people that watch our videos that may not be in healthcare. Can you go over what managed care is?
So, managed care is basically instead of a patient going to a doctor's office and just getting the doctor getting reimbursement for that fee for service visit, managed care takes a lump sum of money and uses that money from the government. If it's a Medicare Advantage program, they take the Medicare money. If it's a Medicaid program, they take the Medicaid money and they give that money to a network of doctors that are supposed to be managing that person's care. And it's called a capitated agreement. It could be either full risk. Full risk means they have to take care of all the care. If it's shared risk, they may share the risk with hospital contracts and with pharmacy contracts and different things like that. So it's a very complex system. And growing up in it, you almost have to grow up and have to be doing it for like 3 years to really understand what it is. But then it gets into quality matrix and HEDIS and other things like that and how the reimbursement scores work. It's a lot of moving pieces. But the main thing is the government wants population health and the government can't afford. They could push people into buying their health plans, but let's face it, most health plans have limited access and it's basically superficial care. No health plans takes a really deep dive into the weeds about your health care. And now we're getting into direct primary care and concierge care. And so those things are evolving now because people are realizing that, hey, all I have is just like a health plan card. But if I call the 24/7 RN hotline, what is it? It's like talking to an ER nurse, but on the phone, and she really doesn't know anything or he doesn't know anything about me. It's superficial.
So you said that you helped them develop clinical programs. How did you participate in the development of the programs?
So early on when I was with Molina, that wasn't really clinical. That was a QA program where we had to quantify, show that we were auditing and all our doctors met compliances with the state titles like Title 17 and things like that. The other things that we did with when I do clinical development compliance for these applications, what we're looking at is we're trying to look at the types of compliance they have to do to meet the qualification for that CPT code that you will be billing out of using that case management program or that remote monitoring program. So we build that in and we build the clinical program protocols that would go around that. Let's say if somebody has hypertension and that's their diagnosis, we will build those protocols around there. I mean, starting with the American Heart Association protocols where they have the stages of blood pressure and then taking a deeper dive into different programs, how you would manage that type of patient with their medications and therapies.
Now, do you have to know computer programming in order to understand how to build these programs?
You hear about all these degrees in nursing informatics and things like that. Honestly, I learned SQL Server without any going to any extra college. That was back when it wasn't embedded in. Now there's a SQL Server embedded into Epic. I do that every day when I run my hospital report right now. So you should be computer savvy, number one. But I think you can learn about anything on the computer with looking it up these days and just keeping at it. It's good to have a programming degree if you want to take it to that level. But most of them, we're going to export and get the programming done in another country. They're not going to pay for a US computer programmer for a lot of these startup companies I help. All their programmers are offshore.
See, that makes a lot of sense to me now because I hired a programmer to help me create that spreadsheet or the program that populates all the information for me that I put on my spreadsheets. For example, this program collects the data from the Bureau of Labor Statistics, and then it grabs all of the cities and all of the median salaries from one of those spreadsheets, and then goes on the internet and sifts through like Zillow and smartasset.com to find out what your after tax income is going to be based on the city and the salary that you're earning from the Bureau of Labor Statistics. It gets all of that information for me. And I paid this programmer initially, it was like maybe $500 to build that program for me. Before, it used to take me weeks just to get one profession in the spreadsheet, but now I can get 50 professions in 2 days.
Right. Think about that task you just did, Jason. They needed your analysis on what actual information that you could capture. They need the same analysis for me when I'm developing these clinical programs for these apps, because now we're talking long term care for patients, not in the sense that they all have to be old, but what's long term when a person is maybe newly diagnosed with diabetes or hypertension or something like that. What type of information will we want to gather? What type of things are part of clinical guidelines that you would want to gather and embed into your application?
Yeah. So if someone were looking to get into your line of work, what kind of qualifications do you think they'd be looking for? Do you need bedside experience? Do you need acute care experience?
You
Okay.
need some acute care experience. I mean, because they have all the programmers, they have people that have Six Sigma, they're project managers and all this other stuff. So they have a lot of like strategists and all these people already. And a lot of these companies are bought by founders and people that just everybody has an idea these days. Everybody has a great idea. And if you have an idea and money, then all of a sudden you're surrounded by yes people. Yeah, we can do that. Well, we can do that. And then finally they call somebody who actually has done it.
Makes sense. At the moment, what does your schedule look like? How many hours a week are you
Oh
working?
my gosh. I'm up at 5:30 every morning because I'm doing my East Coast meetings. I also do some trading. I also like to check the stock market. And then I'm at work here at 7:30 every morning. And then I take another, like this is at my lunch break. Sometimes I'll take a lunch meeting and then I start my evening meetings around 5 on the drive home. But I try to do some gym time and some me time. I'm literally working about 16-hour days.
Wow. Okay, and for everyone who's watching this video, Doug and I have tried to arrange this interview a long time ago, but he's so busy that it's so hard for me to even get him on a call.
But you know what? That's a good thing. We have more people interested in healthcare right now.
Yeah.
We have more businesses interested coming up with some better solutions.
So, what does your role right now typically involve in? So, like, you have multiple things that you're doing, but at work, you said that you're helping with the development of these clinical programs. You have a lot of meetings. What are these meetings about?
Well, at my day job right now, I'm a travel contractor doing interim manager. So we're training some case managers here to be better case managers. Okay. As you know, Jason, you work in a hospital. Case management is very complicated. Okay. You get patients in, they're a train wreck. They have complicated issues. Where are they going to go from here? We could sew them together. We could patch them up. We could send them to OR and they can get surgery. But what happens after that? It's a life changing event. And so we have to teach those people to be able to have those conversations with them immediately. They have to have the conversations with them and their family about, okay, here's where you're at right now. This is where you need. These are your best solutions we can come up with you to get you home out of the hospital. You can't live here. You know, you're not going to stay here and it's not a convalescent home. So we need to move you on. So that's what I'm working on right now. That's my immediate priority. The companies that I'm doing are more long-term ambulatory. And those companies are the ones coming up with the tech solutions. And then they hire me and my team. I have a team of people. It's not just me. I don't believe in a single shingle. I believe you need a team of people. I have a project manager. I have other RNs. I have NPs. I have MDs, DOs. So these people work with me on different facets of this development where we get a contract from usually a tech company, but sometimes it's a tech company in combination with a practice that needs our expertise at how we're going to implement this tech infused program.
Wow, I wish you had more time to talk about this because you got to go in like 10 minutes. But all right, let's dive deeper deeper into that then. How did you start this company and how did you find your people?
I mean, Jason, just like we don't pick the family we're born in, I was very blessed to be born into a good family. It was the right place at the right time. I had been so long in managed care and I already worked on some tech when I first started with Molina because we were tracking all of our audits and stuff. Then it was just right place at the right time. Tech was evolving then. Doctors' offices were transitioning to EHR. And so I think it was just, they wanted someone that was sharp and could pick up the computer really quick and work with tech and understand how to talk to the programmers right away. And I guess I just kind of knew that because I've been a tech geek. I've been using fitness heart rate monitor watches for 20 years. I was using for my cycling. I've been an avid cyclist. I was using it at the gym. I was teaching an indoor spinning class where I was teaching people how to work out within their heart rate zones during my spinning class and explaining to them about what Orange Theory was before there was an Orange Theory. I was always into exercise physiology and learning about, how we can use technology to better train ourselves, because I think we all have to think of ourselves like athletes, because if you think of yourself like an athlete, you're going to be a healthier, just normal person.
Yeah. So how did you build your team from the ground up? Tell me.
So I met some of these people with some of these tech companies and practices that I worked with early on. We started right before COVID. And then when COVID hit, things kind of exploded with the whole telehealth and technology thing. So we were in the right place at the right time. Unfortunately, actually, the main company that I was working with before telehealth, when telehealth hit, they had this technology side of things, but then they just threw that away because they said they were going to go straight to just selling the COVID testing kits. And so they fired me and my doctor partner, because I actually own a practice too. I co-own a regular private practice. They kicked our private practice out, said, we're going to just go into COVID testing kit. You can work with, we were on a project working with a group of caregiver companies. They were this part of this big franchise of caregiver companies. And then it was a group of boarding cares. There was a large franchise where this family had bought, at the time they had about 16 different homes, boarding cares. And so we were testing the technology in their homes on all their patients. So we'd have them do a full set of vital signs, everything technology to the cloud every single day. And then when COVID hit and we were in the middle of that, that's when that company says, well, so long, guys, this COVID testing kit is, we're going to make more money. We're going to sell off that part of the company. You guys could stick around. It's up to you. And it was just kind of sad. They just, I guess money talks, right?
Yeah. And this is why I feel like, me personally, I'm always in the belief that you can't have all of your eggs in one basket. And that seems like where you're at right now. You have so many different areas where you're generating income from. So I want you to go over like some of your income sources if you can, and tell me how much are you earning from your PRN job that you have, your contractor job, and then how much are you generating from the business?
Okay, so my contractor is very high because I'm a manager.
Mm.
So that's like 180,000 a year if I stay the whole year. The other jobs with the different tech companies, I may get a retainer of 4,000 a month or 2,000 a month, or it just depends. It's all over the place depending how big the project is. I'll give them a contract for like 20,000, but they have to put a deposit and give me retainer fee for that. And that goes a lot out to payroll because I have to pay people to manage those different projects too.
Yeah, it sounds like you're killing it though. Like you can earn 180,000 from one job, and that's the security that you get. So you can venture out and do other stuff that you actually really do enjoy doing and managing on your own.
I enjoy this too, though. I think this is the knowledge. I don't know if you've heard of NaviHealth, but I really want to get with big organizations like this hospital organization and help have them create a NaviHealth. If you look it up, NaviHealth sold for like $6 billion to Optum, but basically they put technology on these patients for remote monitoring and started that technology on them in the hospital before they went home. And then they kept monitoring them as they went home. And so I'm trying to get my own version of that with the tech companies that I work with.
It sounds like you're going there based on everything that you're telling me so far.
Yeah, I'll go there. Because I do get recognized as that person that kind of knows a lot, but you don't want to come across as a know-it-all. You know how it is. In any organization, you got to let other people talk. You got to let other people talk and then just listen. And then they want you to do your role. My role is to train other case managers here. And I'm just focused on training them the basics and letting them know this is how we're concerned about dispo. What's the easiest path? We want to get them home with no help. They want to be independent at home, but we know they're not going to be independent. What's the second solution?
And how do companies find you when they're interested in working with you?
I have a website, rpmccm.com. They have info at rpmccm.com. ccm.com. I have a LinkedIn page. I get people reaching out to me. And then, oh, here's a funny thing. I don't know if you've heard of the app Clubhouse.
Yeah.
So I was very busy on Clubhouse. I used to have a show every Friday on Clubhouse.
Wow.
And I was doing a show every Friday in Clubhouse. And I met a lot of tech companies through there. And one of the companies, it's a practice that's in Dallas that we're going to start this urology case management program for BPH. They knew me from Clubhouse. And I get those all the time. Another one that's a mental health app that we're working together on, a mental health app. They met me through somebody else that knew me on LinkedIn. But it's a lot of social media helps. This type of thing helps too, Jason.
That's what I tell everybody, the power of social media, man. And even you coming onto this podcast, there may be somebody out there who might need your services, and they're going to find out about you through this video.
Yeah, that's funny because I responded to the person that talked about these ultra human rings on another person's YouTube channel. The owner of this ring, he's actually used to be an engineer for Medtronic, reached out to me, sent me some rings, and we're doing a pilot with his rings right now. Awesome. It's just crazy how these things happen. So we're testing the technology with these rings. That this is about sleep management and your heart rate variability and stuff like that. I think we're getting to the era where people are starting to understand, hey, I'd rather be understanding tech than taking a bunch of meds. So why don't I start learning about tech, how it can improve my health?
Absolutely. And I know you have to go. So for everyone who's watching this video, if you want Doug to come back on the show, let us know in the comments section so we can have a lengthier discussion next time.
We'll try to do an hour next time. I can do an hour. We just had some technical difficulties today.
Isn't that ironic? Like, we're both tech geeks, but we had technical difficulties.
Tech is, I tell people this every time, tech is never 100%. There's always going to be glitches. You just got to live with it.
If you enjoyed this video, then watch this video here where I speak with a nurse who works for a major hospital system and a Tesla factory in California. And he also owns a Lamborghini and made $600,000 in 2022.